Hey, what's up, everyone? Drew again here, back at ASAPS 2017 at the IM3 booth, here with Dr. Desai from Beverly Hills. How are you?
Hey, Drew. How are you?
Good. Thanks for joining us.
Thanks for inviting me. I'm happy to be here.
Yeah. How's the show going?
Amazing. Tons of new technology here at the show. People presenting their latest research, latest techniques, and then here at the expo, just a variety of new surgical tools, things that I can use in the operating room, things that I can better my patients and give them a better result and make them happier overall.
Sure. Absolutely. Can you give me some more details on some of the sessions you attended? Any tidbits you're looking to bring back to your patients?
Sure. New techniques in breast augmentation and the new pain-free breast augmentation, so the patients can recover faster with less pain.
Really? Tell me about that.
Yeah, so there's certain medications you can give the patient during surgery, and then a certain special surgical technique that can be used so that you're not causing as much trauma to some of the tissues.
Okay.
And then there are a bunch of instruments here at the expo where there's like less heat generated to provide better patient comfort.
Cool. Yeah, it seems like, it's the 50th anniversary here of ASAP. How long have you been an ASAPS member for?
I've been an ASAPS member for a few years now.
Nice. So there's like the evolution of the industry, aesthetic plastic surgery, from surgical, now it's going more to the minimally invasive.
Yeah.
Talk a little bit about that. Where do you see that going in the next 10 years?
Well, I think people don't want big surgeries and big changes anymore. They want small, subtle changes, and they don't want big incisions or big scars. And so some of the things being spoken about this weekend is about making small incisions with the same type of ideal result.
Gotcha. So it seems like the technology, the innovation is catching up to the point where you can still have the same results, but with less of the scarring, less of the work.
Absolutely.
Cool.
Even the implants have changed now that the implants are more of a gummy bear type of material, so they're more highly cohesive.
Okay.
So they're not thought to be as dangerous and longer lasting and much more safer for the patients, because ultimately that's what we all want, is very safe result for the patient.
Sure. So your practice, so you specialize primarily in breast?
I do mostly breast and body work, liposuction, Brazilian butt lifts, breast augmentation, breast lifts.
Okay.
So mostly all of body work, but with a particular interest in breasts.
Gotcha. Another thing you brought up was the BBL, the Brazilian butt lift. That seems like a hot topic. That's going from here to here in the last
huge.
year.
Yeah, everybody wants the BBL now. It's.
How many patients do you have that are coming in showing you pictures of Kim Kardashian saying?
Tons. They all come show me their Instagram pictures or screenshots from Snap, showing me how big they want to be.
Sure. Interesting. Cool. Awesome. Well, I just want to jump into some personal questions, some rapid fire stuff, and get to know you a little better.
Awesome.
Cool. What's your favorite color?
Blue.
What's your favorite sport?
Basketball.
Favorite sport team?
The Boston Celtics. I'm from Boston, so they're my team.
Awesome. I'm originally from Connecticut, so I'm an East Coast guy.
Oh, how funny. Awesome.
Yeah. How long have you been in Beverly Hills for?
I've been in Beverly Hills for a few months now, but I'd done a fellowship there, so I was in the early 2010s. I was in town, so I just kind of came back after a few years.
Cool. What was the last thing you watched on TV?
Some Netflix show that I started to get into, but then there was so many
probably seen it. I've seen them all. Which one?
Narcos.
Narcos, yeah.
Yeah, you see Narcos?
Yeah, with it's about what's his name?
Pablo Escobar.
Pablo Escobar, yeah.
Yeah.
I haven't seen the whole thing, but I've seen probably 4 or 5 episodes.
Yeah, it's good.
Have you seen? Let's see what else is on there. Have you watched Stranger Things?
I need to.
You got to check that out.
And I know it's finite. It's only one season, right?
Yeah, it's coming. Well, they're doing season 2.
Oh, they are.
They're gonna do season 2.
Oh, have you seen? You've seen Breaking Bad.
Yep.
I binged on Breaking Bad last year, and then what I love is he's my boy is Master of None with Aziz Ansari.
Oh, that guy is hilarious.
Have you seen? Oh my God.
I know what you're talking about, but I haven't.
And I was living in New York at the time, and so he talks about like being single in New York and doing the online dating thing. It's
Did you watch Parks and Rec?
No, I didn't. I didn't appreciate him as much on that show.
Okay, well he has a smaller role on that, I guess too.
Yeah.
Cool. All right, let's go on to the next question. Why did you get into plastic surgery?
Well, in medical school, I went to China on a surgical mission, and we fixed kids born with a cleft lip and palate. Kids were born with a little gap between their lips, and so we fixed. We were in the villages, fixed 200 kids. They came from all over, traveled for days. I mean, the stories that I heard are unbelievable.
Wow.
And we fixed 200 kids, all with a 45-minute procedure. Because prior to the surgery, they were ostracized by their village. They couldn't go to school, couldn't have friends, couldn't have relationships, never get married. And then even their parents are it's seen as the devil's infiltrated this family. So even the parents don't have friends. Nobody interacts with the family. And so I went to China, and I thought with a 45-minute procedure, you can change not only this kid's life, but also the life of the entire family unit.
Right. I had read somewhere, and correct me if I'm wrong, and this may be even too morbid for this conversation, but that children born with cleft lip, that they need a cleft lip repair in that part of the world are sometimes either killed or left by their parents.
Yeah.
Is that true?
Yeah, they're left by their parents, get adopted, and that's why in the United States you see a lot of people who adopt children have had cleft lip repair. So they come to the United States, get their lips repaired, and then are taken in by an American family.
Wow.
Unbelievable, huh?
It is. It really is. Well, that's admirable that you went over there and helped them. That's cool. Do you do any kind of philanthropic work like that still?
Yeah, I still do. I went to Haiti 3 times, especially after the earthquake in the 2000s.
Yeah.
So I still go to Haiti.
Man, that must have been, that must have been almost 10 years ago now.
Yeah.
Wow.
Feels like yesterday, huh?
I know. Okay, what were you like in high school?
I was kind of academic, and that's code word for nerdy. I wasn't the cool kid, but that's fine because, I liked class and I liked to study. So.
Cool. Well, I always like to say, because I was a nerd. I was a jock, but I was also a nerdy jock too.
Yeah.
So I had a Star Wars collection and all that stuff. So I always ask, what kind of nerd were you? Were you like the Star Wars nerd, or were you like the bookworm nerd?
No, more the bookworm nerd.
You were like you said, an academic.
Yeah, but I did play. I played soccer and varsity lacrosse, and I rode, and
cool. So
I did certain academic, athletic things, but I kept it academic.
Cool. Any unique talents besides obviously plastic surgery and artistic abilities?
Nothing that I can think of.
Music?
Off the top of my head.
Can you cook? Can you dance?
I can dance.
Yeah?
I can dance.
All right, there you go.
Don't ask me to show you.
Who's your hero?
My mother is.
Nice.
She came to this country at a young age and took on many jobs and raised 4 of us, and went to school as well, and now she's CEO of multiple companies, and so she's done a lot. She's working hard.
Good for her.
Yeah.
Awesome. What's your biggest fear?
My biggest fear, I don't know, maybe being alone.
Yeah.
Yeah.
Like alone in what way? Like dying old and not having anybody with you?
Yeah. Or dying or getting older and not really fulfilling my dreams, and just having things being empty.
Yeah. That's one of my fears, that alone part, is dying last when you've lost everybody else, your parents, obviously, your wife or your husband, and being the last one surviving.
Yeah.
That's scary as hell.
Yeah.
All right. Before we start crying, next one. What do you love most about your job?
Just, the patient satisfaction. You can do something that can just turn around a patient's life.
Yeah.
Something that, has, concerned them for so many years. Every time they put on clothing, or every time they go out, or every time they put makeup on, or every time they're with their significant other, it's like a concern in the back of their mind. And, you can change that and, just change somebody's life and make them more confident, which is going to have, a ripple effect with other aspects of their life.
Favorite movie?
Oh man, there's just too many. There's just too many.
Last movie you watched? Last good movie?
Oh, Manchester by the Sea. Did you see this?
Great movie. Yes, I did.
Oh my God. There's that one scene where he runs into her and
they both start crying?
Yeah.
Oh man, tearjerker. Yeah.
Yeah.
That was a really good movie.
Yeah, and being from the East Coast, I could kind of relate to it to some degree.
Yeah, absolutely.
Yeah.
Left-handed or right-handed?
I'm left-handed.
Nice. So
Yeah.
I keep saying this because about 4 interviews ago, I think it was Dr. Hall Finley from Banff Plastic Surgery in Canada. She had told me that she read a stat that for plastic surgeons, there's a disproportionately amount left-handed versus right-handed.
Really?
Yeah, and I thought that was interesting.
Yeah, well, I think left-handed is supposed to be more
creative, right?
Artistic. I don't know, but I'm a lefty. Barack Obama was left-handed.
Okay.
George W. was left-handed. Bill Clinton was left-handed. So who knows?
So maybe there's bad things too to being like that.
Good and bad. Well, they all got to be president. All those guys were president, so I'm sure
that's true.
They're intelligent.
They did something right.
Yeah.
Okay, last question. If you could be an animal, what kind of animal would you be?
Great question. I would be an elephant because They're big and they're strong and they're very intelligent and they never forget, but they're quiet and they don't make a lot of noise and there isn't a lot of drama. They just, they're just
Sounds like you've thought about this before.
No, I didn't.
You just know a lot about elephants. You're like, I swear, I did it. Awesome. Cool. Well, thanks for joining us. I really appreciate it.
Thank you so much.
Yeah,
Thanks,
absolutely.
buddy.
Have a good rest of your show.
Thanks. You too.